Hi everyone, I'm Sam Lassant and welcome to your Health Partner, brought to you by Lehigh Valley Hospital in Hazleton. And we're here at the Cancer Center today. Now, let me just do a little homework for you. Some of these shows, you know, we bring doctors on and we give you information about what's happening for the betterment of your health. And there are many people that we see throughout the community where they'll come up to me and say, Sam, you know, I'm glad you had that show with this doctor and we learned about this. But the interesting thing is, which I really feel good, and I'm usually with my wife or we're shopping, where they'll come up and say, Mr. Lassant, excuse me, but I want to thank you for having the show and thank Lehigh Valley Hospital for having that show. It saved my husband's life. It saved my wife's life. It saved this life. And that's the whole great thing about these shows, is to bring information to you so you could act. Now, you know I'm the biggest baby walking the face of the earth. I go to a doctor, my blood pressure goes through the roof. So thank God I have a registered nurse as a wife who can say, get there and get your checkups. Today, I'm hoping that we'll be able to save a lot of lives. I'm very happy to have Brian Patson, who is the Hematologist Oncologist up here in the Cancer Center. And doctor, it's nice to meet you.
Well, thanks for having me.
Yeah, I understand you're no stranger to the Lehigh Valley. You've been here before, right?
Actually, I'm no stranger to this area. I grew up in Sullivan County, which is like I don't know, about an hour or so north of here.
Yeah. Mm-hmm. So tell me a little bit about yourself for those people who don't know who Dr. Patson is.
So I'm currently a practicing physician here at Hazleton, and I also see patients one day down at Cedar Crest. You know, I'm an internal medicine physician that did advanced training in hematology oncology. I went to school in Lebanon Valley, which was near Hershey, Pennsylvania, and then I did my medical school training at Temple University in Philadelphia. After that, I did my internal medicine training at Temple University Hospital and subspecialized in hematology oncology at Fox Chase Cancer Center.
Why did you go in that direction?
So, hematology oncology is a very interesting field. You know, over the past 10, 20 years, there's been so much more that we've learned about cancer and all the nitty-gritty details about the genetics and biochemistry and how it works and how to treat it. And I really enjoy the science behind it. But at the same time, it's the connection with your patients. You know, everybody comes to you very vulnerable and scared, and they're usually either in pain or they have some issues with their cancer. And you really have to bridge the gap between understanding the science and how everything works, but also being a human being and helping them through this journey.
You know, the interesting thing about technology, and you know, I know there's many people who have since passed that if we had had the technology we have today would still be alive.
Very much.
Which is great, okay? And so looking at what Lehigh Valley has done in the healthcare, particularly in cancer, I always say, you know, sometimes you get good news and bad news. The bad news is when someone says you have cancer. Mm-hmm. The good news is thank God we have the Cancer Center such as we have here in Hazleton in Lehigh Valley. What have you, as you said, throughout the years, how do you stay on top of the latest technology? So, you know, because you hear, well, you got to go out of town, you got to, I have no idea why, because we have great doctors with knowledge here. How do you stay on top of technology?
Yeah, so I have to say it is becoming very challenging to do so. But one of the things that we have built into our cancer program here is, you know, almost every day of the week we have one or two tumor boards where we're actually coming together as not only my colleagues in medical oncology, but the surgeons, the radiation doctors, in addition to all the other subspecialties that are involved in cancer care. And, you know, we discuss real patients, and then we discuss about what new things are coming along, and that could be either approaches to the chemotherapy, it could be approaches to surgery, or even, you know, diagnosis. So, you know, that's one of the things that we do. Also, you know, it's just as nature of our fields. We are, you know, it's our responsibility to keep up with learning new things, and part of keeping our license active is learning new and updated treatments. You know, we go to national meetings all over the country. The largest one for oncology is in Chicago in May, and I'll be attending, where we learn worldwide what the clinical trials that are being run on cancer and what they're showing, and sort of keeping us up to date.
What is, for our audience, what is a hematologist oncologist, and what do you do?
So what do I do? So, you know, I'm an internal medicine physician. So I trained in adult medicine for 3 years. And then additionally, it's two components. It's hematology, which is blood disorders. It could be ones that are benign and not necessarily cancerous. Things like sickle cell disease, clotting disorders, thalassemias. We learn how to treat those and diagnose those. We also learn how to treat the malignant blood disorders like lymphoma or leukemia, multiple myeloma being some of the more common things. But oncology is sort of the study and treatment of solid tumors. So when you talk about any organ in your body that essentially could develop into a cancer, it's not only the workup, the diagnosis and treatment of that. So hematology, oncology is sort of two fields that were brought together.
March is Colon Cancer Awareness Month. I think every month should be Colon Cancer Awareness Month, you know. But anyway, what is colon cancer?
So colon cancer is, as I was alluding to, different organs in your body. Colon cancer is actually a cancer that develops from your large intestine. You know, you have different GI organs, and the last sort of organ in your digestive system is your colon. And it's a fairly large organ. It starts, most people, it'll be on your right side, sort of at the bottom of your stomach, moves up, across, and then out your bum, and that's, you know, encompasses your large intestine. And these cancers develop in the lining, so it's the lining that's exposed on the inside of the colon, and where they develop.
Now, the rate of colon cancer in U.S. What is it?
So, you know, we could look at it many different ways, and we talk about sort of average risk and, you know, the how common it is. We say that colon cancer is, generally speaking, the third most common cancer. When we break it down in men and women, you know, the most common cancers in men are prostate cancer, the second most common is lung, and the third is colon. When we say in women, the most common one is breast, followed by lung, and then the third being colon cancer. Now, there's also a little bit more detail to that the most common cancer is skin cancer, but we kind of avoid that because skin cancers are easily treatable with a dermatologist. But generally speaking, it's the third most common type of cancer. And generally speaking, everybody, no matter average risk, has about a 4 to 5% chance of developing colon cancer in their lifetime. And we do say it is common. You know, we say that there's probably about 150,000 new cases every year in the United States. Wow. And currently, the recent statistics that are reported, it's about 1.4 million people in the United States have colon cancer at this time.
What are the risk factors?
So risk factors, you know, there's been a lot of studies looking at what the risk factors can be. We know that some of the things that are most obviously associated is age. So anybody over 50, and actually the rates are increased between 50 to 60, it's the most common risk factor. Other things that we know about are obesity, so being overweight, alcohol consumption, excess use of alcohol consumption. There is some belief that diabetes may play a role in this, but that could also be sort of the diabetes, metabolic syndrome. Smoking increases your risk. And then other things that have been reported in the literature and still are not quite clear: excess meat consumption, red meat specifically, processed meats can be a risk factor. And you know, there are some syndromes where families have either increased risk of polyps or have inflammatory bowel disease, things like Crohn's or ulcerative colitis, those are always sort of at increased risk. So some of your family history is also a risk
I'm
factor.
reading here that colon cancer they're increasing among young people.
Yeah.
They're 45 years old.
Right. And so, historically guidelines were stating about 50 as the initiation for your screening for colon cancer. I think it was probably in the past decade, it's really been noticed that there have been younger people, even as early as 40 or lower, that have been developing colon cancer. And, it's not clear why. It might be something environmental, it could be diet, but certainly recently the concern was enough that the age has now been changed to 45 to start colon cancer screening.
Okay, so what are the preventatives? What do we do
Yeah.
to prevent these things from happening?
Right, so the things that are well established, exercise. So, and that probably not only correlates with being more active, but maintaining adequate body weight. Other things that are very important, fruits and vegetables. Going back to, where meats can increase your risk, fruits, vegetables, fiber, people with those in their diet tend to have, can be more protective. There is some information about aspirin that has been well established. Before anybody would just start aspirin as a protective, you probably should be consulting with your primary doctor about this. But those anti-inflammatories do play some role.
Are there any signs that you should look for if you feel, other than going for a screening colonoscopy?
Yeah. So, some of the common signs and symptoms, certainly changes in your bowel habits. So if your stool looks different, if you feel like the way in which you're having bowel movements has changed, blood in the stool is definitely something that needs to be evaluated and could be concerning. So if you see red blood or changes with darker blood in your stool, other things are abdominal pain, bloating, that just doesn't seem to be quote unquote normal for what you're eating. Those should always be evaluated. And weight loss, unexpected weight loss that you just can't explain. Those are all signs and symptoms.
Colonoscopies, okay, they're not the favorite thing for people. However, they're a lot better than they were years ago.
Sure.
Okay, tell me about a colonoscopy and who should get one.
Yeah. So colonoscopies, and just to clarify, that's not exactly something I perform, but a colonoscopy is a procedure that's performed by another physician who has advanced training in medicine called a gastroenterologist, in which you can not only have detection of potential abnormalities inside the colon, but they can also intervene. And that's one thing that's very important about a colonoscopy, is that it's not only helpful in diagnosis, but it can treat or at least biopsy areas that are of concern. So a colonoscopy, it's generally a procedure that has to happen within a medical facility, okay? It could be in a hospital, it could be an outpatient surgical center. Generally speaking, you would need to have a visit with the person doing the procedure, and they go over sort of the risk and benefits and do the scheduling, because depending on your health risk, it will determine if you're doing it at the hospital with more monitoring or whether it could be done as an outpatient. It usually involves at least a day for the procedure, and the day before you do some preparation at home. So part of the preparation for a colonoscopy is essentially clearing out your bowels. And it usually entails taking either liquid or a combination of liquid or pills. We call it a bowel prep. And essentially what it does is it helps to, you start with a clear diet, 24 hours before your colonoscopy, and then the evening before you'll be taking these medications that essentially cause more water to come into your colon and flush it out and clean it out. Because it's really important that you have a good bowel preparation so that a colonoscopy can be effective when they do the procedure. So then the day of the procedure, you will go to the center. They get you set up and hooked up to the monitor. You do have to change into a gown. And a colonoscopy is a procedure that they usually give in the United States some sedation for. So you don't know that it's happening, you don't remember what happened, and you don't feel any discomfort with it. So, rest assured that's usually the case. It's a good nap. It's a good nap. You wake up and you don't even know anything is really happening. You might feel a little bloating because they sometimes need to put air in there to open up the colon, but they do that just so that they can look very carefully. So once they get you all set up onto the monitor, give you the medication, you usually go off to sleep, and then they use a colonoscope, which is a small tube which has a very high definition camera. It's almost like watching television with very high definition. They have this little camera. They have other instruments on there that can either insert water or insert air, and then little devices where they can do biopsies or what they call a snare. And then this scope gets inserted into your rectum, and then it goes up, as I said, through your colon on the left side, across, and it's flexible, and they maneuver it almost like a video game to get to the very end of the colon and usually into the small bowel, so that they have a good visualization of the whole colon, even into what's called the cecum, into the small bowel, and they can look for any abnormalities in the wall of the colon. If they find something abnormal, they will determine whatever it looks like, whether they biopsy it or they actually use this snare device and they actually remove it.
Okay.
So they intervene at the time of the procedure.
Which is great.
Yeah.
Went to have one piece of cake. I said, a piece of cake. I said, what am I getting all nervous about, and we went there, it was just like that. I'm talking to Dr. Patson, who is the Hematologist Oncologist up here at the Cancer Center. We're going to take a break. We'll be back right after this. Welcome back. I'm Sam Lassant, and we're here at your health partner, Lehigh Valley Hospital in Hazleton. I'm here with Dr. Brian Patson, who is the Hematologist Oncologist, and we're talking about colon cancer, and just tuned in. I highly recommend that you want. We're on their website 24/7, ssptv.com, and of course our YouTube channel. Doctor, let's talk about changing and screening for colon cancer, or for the colon.
Yeah. So I believe it was around 2018, some of the new guidelines have actually decreased the age of screening. So historically it was around 50, but it's now 45. And that is people at average risk. So if you have a family history, or if you have other bowel disease, your screening age might actually be younger than 45, but an average risk person is now 45. And part of this has been sort of trends that have been noticed in Caucasians and Hispanics, where there have been younger diagnoses below 50 before our prior limit of screening of colon cancer. And so therefore the task force have decided to decrease the age to 45.
Okay, now there's other forms of tests that you don't have to go to the hospital. The color, is it the...
Sure. So we could talk about the other tests. They generally will help to determine if there's anything abnormal in your stool, okay? That could then correlate with something abnormal in your bowel. So some of the most common things are initially checking for blood in the stool. And your primary care can do this, and and you can have it done at most labs, is actually just checking blood in the stool. Now, that's all it does, is it actually checks to see if there's blood or not. It doesn't tell you anything whether the source of the bleeding or whether you have colon cancer. And the next recommendation is to get a colonoscopy. Another widely available test through your primary care doctor is called Cologuard testing. So Cologuard testing takes it to the next level. It actually does test your stool. It not only looks for blood, but it also does additional testing to look for some of the more common genetic abnormalities, gene abnormalities that we see in colon cancers that might be released in your stool and then become positive in the test. Again, a Cologuard test does not diagnose you with colon cancer. If you have an abnormal test, you still need to have a colonoscopy.
All right. So you're diagnosed with colon cancer. Okay.
Yes.
How do you treat it?
Okay. So, that colonoscopy, the doctor doing the test will see something abnormal. He'll do a biopsy. That specimen has to go off to a pathologist who's another specialized doctor working in the system. And then they do special tests and staining and determine, what kind of cancer that is, okay? Once that's been established, generally at the time of the procedure, if there was something of concern, the doctor doing the procedure will do a little tattooing or marking of that area in the colon. And the next step is that you would be meeting with a surgeon, okay? A specialized surgeon who is skilled at removing parts of the colon. And that's usually the next step. So depending on whether that area was completely removed or there is a concern, you would see a surgeon and have part of your colon removed with appropriate examination of lymph nodes that will be removed. And that whole specimen goes to a pathologist also, because the next step is sort of determining the stage, sort of how advanced the cancer is, because treatment after that is sort of determined based on the stage.
Hence why you should get a screening and get a colonoscopy.
Hence why you need to get a colonoscopy.
So the earlier you find something like this, the better off.
Absolutely. The earlier you make a diagnosis, the earlier stage of your cancer, the better survival. We know that about 90% of people who have early stage 1 colon cancer are still alive at 5 years.
Yeah.
As opposed to if it's stage 4, it drops down to almost like 12%. At 5 years, people being alive.
So once again, the team is very important. Okay, and
it's a big team.
Yeah, and describe that team for us so people know all the people that are involved.
Sure. So as we mentioned, you've got the GI doctor or the surgeon who does the initial colonoscopy. You'll have a surgeon who does the appropriate bowel surgery, resection, removal of the lymph nodes. You have your pathologist who reviews the specimen and helps to determine the diagnosis and whether there's lymph nodes involved. You actually have radiologists, so doctors who are specialized in reading images, because that's how we, take images of the chest, abdomen, pelvis to see if there's any potential spread anywhere else. And then you'll have myself as a medical oncologist. You could have a radiation doctor. Rectal cancers, which is the lower part of the colon, is treated a little bit differently than colon, which is sort of higher in the large colon. So a radiation doctor may be involved, and you may not have surgery up front. You might get treatment up front before you have surgery. So all of these are very important members of the team, let alone all the nursing staff and subspecialty that are involved.
Once again, for our audience, in terms of looking for what are the risks, what should they look for if there's something happening with their bodies?
So you need to meet with your primary care doctor. This is where it starts. Not only meeting with them if you're having symptoms, but this really starts the first time you meet your primary care doctor in telling them about not only understanding your lifestyle, your risk factors, your family history. Knowing your family history, meaning bigger concerns are your first-degree relatives, your children, your brothers and sisters, your parents. Knowing their medical history is very important because it actually helps to establish when you should start your screening and what things you're at high risk for. Okay.
We're here at the Cancer Center, okay, and I know we treat more than colon cancer.
Correct.
Here. What are some of the areas that you also treat here at the Cancer Center?
Well, we treat essentially every cancer. Here in Hazleton, some of the things we're a bit restricted with, some forms of leukemia. Acute leukemia we do not treat here on site because a lot of times the treatment is in the hospital. Those patients are treated down in Allentown at our facility with the subspecialty hematology team. But essentially any other cancer we can treat here, from almost nearly from head to toe.
It's interesting, we were talking about technology and how advanced it is. And we're very fortunate to have that kind of technology here in Greater Hazleton, but also in the entire network, okay? So doctor, let's talk about your pharmacy.
Health Spectrum Pharmacy, which is the Network's pharmacy, has now opened a new location here at Hazleton. So not only do we as employees, have obligation to get our prescriptions there, but the general public. It's now open to the general public. So, one-stop shop. You're in the hospital, you're here at the center. If you need to get to the pharmacy, it's right here on the campus.
In terms of the Topper Cancer Center and everything else, the participation we have, what are some of the other things that the public should know?
Yeah, so one of the great advantages, and now we have here at the Hazleton campus, are clinical trials. So our affiliation now with Thomas Jefferson University Hospital and the Cindy Kinmel Cancer Center, in addition to our affiliation with Memorial Sloan Kettering, we have clinical trials, and these are sort of advanced studies, using sort of the very latest changes in how we treat cancer. And we make them available to the people here in Hazleton, in the surrounding area. Historically, you'd have to have traveled either to Allentown or, for that matter, to Philadelphia to get these trials available to you, and you can get them here in the backyard. A lot of these trials, we spend a lot of time studying and talking about which are best. And we will choose trials that will say, you're either going to get the standard of care or the standard of care plus, or we're going to have trials that help us to learn more about your cancer and possibly learn how best to treat you. So, we really do choose trials that really help to put you at ease and not say that you're going to be treated as everybody quotes, worries about being a guinea pig.
Yeah.
But we're really going to try to give you, if at least the standard of care, if not something plus.
Well, doctor, it's a pleasure meeting you. And
Was
I
great.
wish you the best.
Thank
okay?
you. It's
As
great
I
having
said,
you.
my friends, prevention is so important. Get that screening, go. It's a piece of cake. I'm telling you, this guy did it. It was a piece of cake. For any information, website's on the screen. Go there, see what's going on, protect yourself. And I want people to come up and say, Sammy, thank God you had Dr. Patson on the show. You saved our lives. We'll see you next time.